welcome to this episode of Ask Dr. Jessica. I'm really excited. I have Dr. Michael Levine. He's a toxicologist. How are you, Dr. Levine?
I'm great. Thank you so much for having me. How are you?
I'm great. Thank you for being here. So I wanted to start off by asking you, what is a toxicologist?
So a toxicologist is a physician that's usually either completed a primary training in emergency medicine or in pediatrics that then goes on to do additional subspecialty training in poisonings and overdoses and venomations and adverse drug reactions.
So does a toxicologist have to be a doctor?
Well, there's two types of toxicologists. You could have lab toxicologists that do bench work, meaning usually they're PhDs, they do chemical type research and stuff like that. But in terms of for clinical or medical toxicologist, that's a physician.
Okay. And how did you get interested in the field of toxicology?
It's just always been something fascinating. It's interesting to see what you learn in med school, what happens when you take whatever medication. But then in toxicology, you learn what happens when you take whatever medicine times 50 or times 100. So it's like an applied pharmacology and biochemistry, and it's kind of fun. It's kind of nerdy, but it's kind of fun.
Now, out of curiosity, what are the most common patients that you see?
Probably the most common is actually going to be Tylenol or some antipsychotic ingestions.
Okay, so where people overdose on Tylenol and
Correct.
antipsychotics?
So intentional overdoses of Tylenol or acetaminophen is probably the most common ingestion that a toxicologist sees, followed quickly by those who are intentionally ingesting antipsychotics.
I thought I would ask you about the most common medications and pharmaceuticals that I give to children, because a lot of parents are concerned that when they give medications to kids that we will be harming them in some way, that the risk will outweigh any benefit. Maybe we can start with Tylenol now that you brought that up. A lot of parents, will want to take Tylenol when children have fevers or aches and pains, and we recommend it. And then I talk to parents that are nervous to give the full dose. Like I might check in on them about how their child's fever is doing, and then when I ask more questions, it turns out they gave half the recommended dose because they're nervous that it will harm their child. How safe is Tylenol for children? Can you comment on that at all?
Yeah, Tylenol
hopefully to help parents worry less.
Tylenol is exceedingly safe in anyone at therapeutic dosing, and especially in kids. Even in overdose, it's relatively safe in little children. So when we think of Tylenol, the FDA has set limits for how much Tylenol you should take, or what's the recommended dose. That's substantially less than what's potentially a toxic dose. And then even from that potential toxic dose, the FDA has even further lowered our treatment thresholds out of an abundance of caution. So for years and years and years in Europe, when someone took intentionally or unintentionally, but significant overdoses of Tylenol, there would be a threshold when to treat. And at that threshold, most of the Europeans knew that there was a very small risk that your liver could get hurt in really high-risk populations. And the U.S. said, no, if we could save even one life, we're going to. And we have even a 25% reduction in our treatment threshold, even beyond that. So in the U.S., we are incredibly cautious about doses we give therapeutically. We're incredibly cautious about our treatment thresholds for treating toxicity. And even more than that, kids, especially under the age of 8, it is exceedingly rare to see liver injury due to Tylenol. They metabolize Tylenol differently than adults do, and their liver is bigger proportionally to the body size compared to adults. And those are two reasons why it's just so rare to see significant liver injury in a little kid from Tylenol. Tylenol is probably one of the safest drugs.
That's so interesting you say that, because as you just mentioned, that Tylenol is one of the most common calls you get for intentional overdosing.
I do. I think that's just because that's what everyone has in their house. So in terms of for intentional overdoses, when someone's upset and they try taking an overdose to harm themselves, they run and grab the first thing they see, which usually is, and I'm saying Tylenol, that's just obviously a generic, any type of acetaminophen. But that just people take what they have around. But acetaminophen is probably one of the safest medications on the market at therapeutic dosing.
So this is great for parents to hear. So what you're saying is if they follow the dose recommendations on the bottle for children, and they For example, Tylenol is recommended every 4 to 6 hours. If they follow the dosing and the interval recommended, you're saying as a toxicologist that is safe.
I'm saying it's exceedingly safe. It's probably one of the safest drugs on the market.
That's great to hear. Really great to hear. Have you ever had, in your experience, a child overdose on Tylenol?
I've had teenagers for sure. I've had some, rarely some sub, like adolescents or just slightly below teenagers intentionally overdose. And in terms of even parents accidentally giving too much, it's exceedingly rare. So in 12 years as a toxicologist, I could tell you I've seen maybe 1 or 2 times that a child, meaning like an infant, actually even got mildly sick from the parents giving them too much Tylenol. And that was a mix-up where one parent was giving the full dose and the other parent was also giving the full dose, and they weren't communicating with each other. And then the babysitter was still intermittently giving a dose as well of what they didn't realize Tylenol was acetaminophen, so they thought it was a different product. So the kid was getting at least a threefold overdose over the day, and like every hour was essentially getting a dose of acetaminophen, and got mildly sick. We admitted the child overnight, but did absolutely fine. So in terms of true overdosing, when you're using it therapeutic dosing, what's recommended on the bottle, never seen anyone get sick from it, and it's one of the safest drugs out there on the market.
It's so helpful to hear. Thank you so much.
Yeah, of course.
What about the other common medication we give, ibuprofen or the brand name, Motrin, Aleve? Is there any concern with that medication giving the recommended doses for children?
No, so if you give it to real little children, especially those under 6 months, there's a theoretical risk of maybe mild toxicity, and it may not be great for their kidneys. So we try not doing it for children under 6 months of age. But it's, in general, certainly above 6 months of age, it's a very, very safe medication as well at therapeutic dosing, especially if you're going to be giving it on the short-term interval like you would for a child with a fever. You're going to give it for a day or 2 or 3 maybe. You're not going to be giving it multiple times a day for multiple years.
And if a child were to overdose, what are the expected side effects? The reason why I'm asking, a lot of people are concerned if they take too much ibuprofen, they'll have stomach upset, stomach side effects. And then I've read that side effect is over-discussed. What do you have to say as a toxicologist?
I
Any
think
comment?
at therapeutic dosing, it's possible your kid could get mild upset stomach. If you're using it for multiple days, it's possible your child could get a little bit of irritated stomach and maybe a little bit of mild epigastric type of pain. But in terms of for significant dangers, it's really pretty unusual. And in terms of for when you actually start getting toxicity from an overdose, you're talking pretty large doses, way larger than any little child would get from an accidentally the parents giving slightly more than the recommended dose. If you use the recommended dose, is what it says on the bottles, you're going to be just fine.
I love that you're clarifying this point, because what I come across often is parents are nervous to give the dose, more than once a day, more than twice a day, even though it is okay in the case of ibuprofen to give it every 6 to 8 hours. They're worried that they're going to harm their child in some way. So I think it's really helpful to hear that if we stick to the therapeutic or recommended treatment dose, children will be okay. And in your experience, that's correct.
Absolutely. Right? Just follow what it says on the bottle for either acetaminophen or for ibuprofen, and the kid is going to be absolutely fine. And I think in many regards, even if it's just that the little kid feels crummy and the acetaminophen or the ibuprofen helps with the fever and then feeling less crummy, I think the risks of having the kid just feeling crummy because they're feeling sick are so much higher than the kid getting any type of significant toxicity by giving either of those medications, or frankly both of those medicines together in the doses that are on the bottle, that I would say definitely go ahead, liberally give it, just follow the instructions on the bottle, and give the dosing that's recommended on the side of the bottle at the frequency recommended.
Another common medication that we give children is Benadryl. It's often given for hives or various allergies. Have you ever seen a child overdose in a significant way from Benadryl?
I have. So Benadryl is a much narrower, what we call therapeutic index, meaning the amount that you could take before someone will show signs of toxicity. So again, at therapeutic dosing, it's pretty unusual to get sick. It is recommended to avoid any cough or cold products with either Benadryl or non-Benadryl, cough and cold products under the age of 2. They just don't really work all that well. But in terms of specifically for allergies with Benadryl, it's fine to give Benadryl if your kid is having an allergic reaction. I wouldn't give Benadryl under the age of 2 unless your doctor's recommending it. But even then, sometimes we will definitely go ahead and give Benadryl or diphenhydramine to little children, meaning under the age of 2. So do you see people getting sick? Yes. It tends to be more those taking large doses or intentional overdoses, but occasionally you see people getting mildly sick from too much Benadryl by giving, even at therapeutic doses. Although usually when I say mildly sick, they have dry mouth, maybe they don't feel quite right, but not truly dangerous toxicity. It's certainly not a therapeutic dosing.
So have you ever seen a child have so much Benadryl that it's caused long-lasting issues? Or is it more short-term side effects?
It would be short-term side effects. It wouldn't be long-term effects.
Okay, so it sounds like for Benadryl, there's potentially more harm than the first 2 medications we were talking about, especially if it's given over the dose that's recommended.
Correct.
Okay. And you touched upon cough medications. I think this is a great tip because it's confusing for families because for example, when I was a kid, cough medications were given often and recommended for children with cough, and then we've changed that recommendation in the last decade or so. Can you comment on why that was a good policy change in your mind?
Yeah, so there's just no data that those are actually effective, and certainly in real little children, so children under the age of 2, there's just no data that any of these cough and cold medicines actually do any benefit, and there's a small but a theoretical risk of causing some harm. So the risk is still pretty small in children, even under the age of 2, but there's zero benefit. So if there's zero benefit, even if there's small risk, it's recommended not to do it. So there's a fairly hard recommendation under the age of 2. There's a quasi don't give it recommendation. I mean, you probably shouldn't, but not quite as hard of a recommendation for 2 to 6 years of age. So above that 6, absolutely fine to give cough and cold medicine. Use it as directed again on the bottle, and you shouldn't have a whole lot of issues.
Right, and and as you mentioned, the big question is, do they actually help? And the data shows they are not very helpful in terms of improving cough and cold symptoms. So if it's not going to help, why give it? Potentially harmful.
Correct. And the other thing I will say is just make sure to, whenever you're taking any of these medicines, just check what's in the bottle and what's actually in the ingredient. So a lot of these have generic medications, a lot of these have brand names, and parents sometimes don't realize they're giving one medication that has one thing, and then they're giving another medication and a third medication, and they're really all the same medicines just with different brand names on it. So occasionally you have people get a little bit accidental overdoses by taking too many medicines that they're not actually trying to hurt themselves or hurt their child, but they just get confused. And even though they're reading the instructions on the bottle, when you have 4 different bottles of the same medicine, that doesn't give you 4 times the right to use 4 times the dose.
Right. No, that's an excellent point. I think it also would be helpful. Can you say what those are? I mean, the first things that come to my mind are Tylenol is the same thing as acetaminophen. Benadryl is the same thing as diphenhydramine.
Correct. So Tylenol is acetaminophen. Ibuprofen is either Advil, Motrin, and then medicines like Aleve, which is very similar. It's not quite the same, but very similar to ibuprofen. So you have other medications, but even more than that, just for example, sometimes we'll see people giving Tylenol PM as one medication, and then they have Tylenol, then they have it for like older children, then they have so older kid has the flu, so they get Tylenol, and then they have fever control, and then there's Walgreens pain reliever because they still ache all over, and then there's not that there's anything the matter with Walgreens specifically, but any of the generic brands, it's all looks the same. They're all slightly different names, but they all have the same product in them. The parents have a Norco left over from when the kid had ankle surgery, and here you're aching so much, take a Norco, and then here take a Tylenol for your fever, and then take fever control medicine, that's the generic fever control medicine, and then take the generic cough and cold medicine for your runny nose, and before you know it, at that point you actually are getting a large quantity of the same medication. In this case it would be acetaminophen. So just be aware, while we said acetaminophen is really, really safe, and it absolutely is, make sure that you're still reading the instructions on the bottle and not taking 4 or 5 different of those same medications.
Can I ask you about vitamins? To ask you about vitamins, over the years when I've been on call, I've gotten this page multiple times where a child will accidentally get into a bottle of vitamins. They look so good. A lot of times they look like gummy bears, and so children will ingest many at once. Can you comment on if you've ever seen a child have an overdose from vitamins and if that's caused any harm?
Never seen it. So let me rephrase that. I've seen many kids that have been brought in. So the biggest, I think, worry with that would be iron. So even though many of these multivitamins contain iron, and even though iron in overdose is clearly potentially very dangerous for children, or adults for that matter, it's almost never seen that when children are taking multivitamins with iron, or even children or adults that take prenatal vitamins with iron, for whatever reason, it's almost unheard of to actually get sick from the iron in that preparation for whatever reason, and it's not really clear why, but it's exceedingly rare.
Another question that's come up more recently in the last couple of years, I think because of its recent legalization, but I've gotten quite a number of phone calls where children will accidentally ingest parents left out marijuana edibles. Can you give any advice on that? On that topic, have you seen this, and do you have any advice for parents?
Definitely have seen it a lot more since legalization in the state of California. So prior to that, every once in a while you would see it, and then you would see it, and it would be a problem. But definitely since it's now in so many different forms, 10 years ago, marijuana was something that you smoked. A marijuana gummy was like an unheard of thing. No one's ever even thought of that. Now you have all these edible products. They look like candy. They look like gummy bears. They look like Skittles. They look like all sorts of different products, and you absolutely see little kids getting into that. They think sometimes they see the parents eat it, and they think it's good for mommy, it's good for me, and the little kid will intentionally eat it. So unlike what we said before, where we said if you take what's as directed, it's totally fine, this is not the case. So a little kid eats a edible or eats some marijuana product could actually get pretty sick, and sometimes even need to go to the ICU.
Wow. What are the symptoms that you see?
So we see a couple things. So we see a lot of vomiting, we see a lot of sedation, and we see the kid starts to get they look almost like they're drunk. They start stumbling around, they're really, really sleepy, they're not breathing very well or very effectively, and they're sometimes frankly comatose or really, really difficult to arouse.
Wow. And eventually do they get better?
Yeah, they typically get better, but sometimes they need to go to the hospital, they need to stay in the hospital, they sometimes need to even go into the intensive care unit. Rarely they have to have like a breathing tube put down, but you definitely do see kids get much sicker from 1 or 2 tablets or 1 or 2 gummies or 1 or 2 whatever form of an edible from marijuana, and certainly much worse than you would see from 1 or 2 tablets of any of the other medications that we had just discussed.
I think this is such a great cautionary tale for parents listening, just to make sure everybody's being extra careful about where they store these edibles. I've been definitely surprised how much the situation has come out where parents accidentally leave out their edibles. And of course, as you mentioned, children, they look good. So kids will try them, and gosh, what a terrible feeling to feel like you harmed your kid in any way. So hopefully parents listening out there will be reminded to make sure they properly put away their edibles should they purchase them.
For sure, and don't be lulled into the sense that it's in a child-resistant container. Those things are magnets for kids, and kids see it as a challenge. Aha, I can't figure, they don't want me to get into this. And it's a puzzle. I'm going to keep trying and trying and trying. Kids could get into any child-resistant container that they want to get into.
That's scary. That's a good point. I think I remember when it first was legalized in Colorado, it was a crazy number of hospital admissions increased for children after the legalization.
Yeah, astronomically high. They published it out of, I believe it was out of Denver, where they looked at it. And they had a paper, if I'm not mistaken, it was in JAMA, and they looked at it. And just a huge number, and I don't remember the exact percentages, but exponentially increased number of little kids getting admitted and sometimes getting quite ill following marijuana ingestions, which was almost never heard of before.
Wow. There's been a lot of caution about lead for children, especially parents that live in older homes. Can you touch on lead ingestions, what signs parents should look for? Is this common, and what can parents do about it?
Yeah, so it is relatively, it's kind of a mixed question. Is it common? Well, it's all relative. It's definitely much less than it was 20 or 30 years ago, but it's definitely not unheard of. It tends to be more common in older houses. It tends to be a little bit more common in lower socioeconomic statuses. It tends to be certainly more common in different demographic groups. So one of the things that, while you can see toxicity with outward manifestations, like the person could have a seizure or could be very confused, that's in exorbitantly high levels and typically not the levels that you're going to be routinely encountering. So even more mild symptoms like constipation or joint pains, those are still not usually going to be anywhere near the levels that we're going to be routinely seeing in kids. And certainly in California, we routinely check lead levels on every child as part of their routine health visit at the age of 1 and I believe at the age of 2 as well. It's somewhat different in different states, but it's still a routine thing to be checking for and screening for at that point. So it's definitely less. We've got rid of many of the different lead sources that people were previously exposed to. And while I'm not advocating or encouraging not treating lead, and I'm not advocating ignoring it, I do want to put it in historical perspective. So if you look in the 1960s, the U.S. Public Health Service said a level of 60 just means there's high lead absorption, and that's all they said about it. Over the decades, they kept lowering the level. They lowered it from from an action level, then they called it a concern level. Now they call it a reference range, and we have it was 20 and then 10, and then they changed it to 5, and then now they've even lowered it, the recommended level, to be under 2.5 as of last year. And that's even, the 2.5 from 5 is not based on anything other than what 95% of the children are under. So they've now lowered that even further, but it's not based on toxicity. So just put it in historical context. Most parents, right, the average lead level in the 70s was 12.5 in the late 70s. So the average pediatric lead level in 1978 was 12.5.
And did you see any clinical harm from the 12.5 level?
Well, I wasn't seeing anyone at that point. I was a little thin myself.
Or I guess I should say, sorry, I guess I should say.
But no, we weren't. So on population studies that they've shown that every 10-point rise in your lead level above 10, there is about a 5-point drop in the IQ. That is not to say that's an individual thing. That's a population thing. So while I don't know Einstein's lead level, I could virtually guarantee you it was above 10 from when he was alive, because everyone's was above 10 when he was alive.
And he still had a pretty good IQ.
Yes, he did.
So do you see any, so I understand that the blood levels will be a certain number, but as a toxicologist, when do you see clinical symptoms from lead ingestion? Have you ever seen lead toxicity in a child?
I have seen several kids with elevated lead levels, but not really exhibiting toxicity. And that's even at levels in the 20s. They're all pretty asymptomatic. So I've seen people symptomatic from lead. I've never seen that in a kid. I've seen it in adults. Usually it's occupational related, and we're talking levels of 70 or 80 or 90. And yes, they do have symptoms. But that's, again, levels of 70 or 80. And while I will absolutely say we have different treatment thresholds for kids than for adults, and we're much more concerned about a kid with high lead levels than an adult, because the neurons aren't fully developed, they're still developing brains, and the brain is much more susceptible at younger ages than older ages. It's still really, really rare in current times to see someone actually symptomatic and ill from lead these days.
It's good to hear. I think it's really important for people to be aware, so we obviously avoid lead ingestions. But I also find it helpful to know that in your experience, it's not very common, especially with screening and proper measures being taken.
Correct. And again, if you have lead, so little kids tend to get into lead or get high lead levels due to oral behaviors, right? It's all hand to mouth behaviors. There's lead dust on the paint, so they're eating paint chips, they're eating sometimes soil that has high levels. It's all putting things in your mouth. So if you're outside playing, wash your hands. Try washing the kids' hands before going inside having a sandwich. If you're in an older building and there's lead paint on the walls, if you're really, really concerned about it, apply a new layer of paint over there. It's not an issue actually if you have lead paint on your walls and you put a new layer over that. That actually seals in the lead fairly well. It's when you try sanding it all down and you try doing your renovations, then you create all that dust. That's when you get actually much higher lead levels. When you're trying to resand down and get rid of the old lead paint, than if you just reapply a new layer of paint over there. And virtually all household, or not virtually, all household paints that are sold in the U.S. these days have no lead in them.
Another misconception, a lot of parents are concerned that when their children put their pencils in their mouths that they're ingesting lead. So I just want to say it out loud that
Those
the
don't have
pencils
lead, it's
actually don't
graphite.
have lead. Yeah, it's graphite, right? Yeah.
Totally fine.
So totally fine, yes. So thanks for clarifying that. I'll have a child that'll put their pencil, they'll make a mark on their arm, or they'll draw on themselves, and parents are concerned they're getting lead, but
They're
it's
not.
not lead. Yeah. Good to hear from a toxicologist
Thank
confirming that. Now tell me, any advice for parents if they are concerned that their child had an ingestion or an overdose? Maybe can you talk about poison control or any resources for parents?
If parents have any questions at all, they should call Poison Control. It's 800-222-1222, and that's for anywhere in the United States you could call. It's a free service for the public. You could call that number, and poison controls have been shown in multiple studies to be cost-saving measures. So those are especially good for parents where the kid is, or anyone is concerned that they got into a medication, a cleaning product, a whatever product, and they're very good at looking up the product and being able to say, do you need to worry or do you not need to worry? And if you need to worry, they're very good at saying, go to the hospital. And in some jurisdictions, they'll even call an ambulance for you if they need to. That's very regionalized or very state specific or dependent in terms of what they do. But if you have any questions anywhere in the United States, just call the Poison Control number. It's 800-222-1222 if there's any questions, concerns. And in most cases, I would probably, especially for little kids that get into a medicine, I would probably even recommending before just bringing them to the hospital as long as the child's really asymptomatic.
In your experience, are there any ingestions that parents don't worry enough about? Is there any advice that you can offer parents to be extra careful?
There's definitely some medications in terms of prescription medicines that one tablet could be problematic for a child, especially some of the diabetic medications like glyburide or glipizide or glimepiride, or that class of medicine called sulfonylureas. There are a couple blood pressure medicines like verapamil or propranolol that even a single tablet could be very potentially dangerous. Some of the older antidepressants could potentially be very dangerous even in single pills. So I think the big thing is, especially when you have grandparents coming over, or you have the holiday times and there's 10,000 people coming over, just remember to keep the medications really out of reach of the kids and not just put them on the counter. I think it's often easy to forget and just leave the grandparents come over, they're staying at the house for a couple days, they just leave them on their medicine on the counter there. And just time and time again, we'll see kids getting into grandparents' meds. And when you think of from a public health standpoint, it's not guns, it's not gangs, it's grandparents. They're a constant threat to kids' lives. We just have to keep grandparents away from kids. And obviously I'm being facetious when I say keep them away, but you should keep note and really keep track of where the medicines are and make sure that they're not just in a child container, but they're really up somewhere tall out of reach from the kid.